Groove Cafe.
It is the Groove Cafe, and I am Crystal. Always looking forward to getting to know my guests more and hear their stories. Today, I have the Executive Director of Safe Places Uganda. She's a founding member, and it is a private treatment center for psychiatric and psychological disorders. She's very passionate about mental health, and these are conversations we're having more and more of. I have Janet Kantalama joining me today on the Groove Cafe. So welcome, my dear.
Thank you very much, Crystal.
How are you doing?
I'm honored to be here.
It's my pleasure. It is my pleasure. We were talking villages and ancestors just to bring you in. But you let me know that you were born at Mengo Hospital.
Yes.
Here in Kampala.
Yes, and my home area is Bandwe, Nalumunye.
Which is really not far.
Yes, it's just near there after Kaboja, that's, the old Massacre Road. A few minutes from town.
Okay, where was school for you?
Initial school, primary was Namilyango, St. Teresa, Namilyango Girls in Mokono Seta. High school was Gayaza High School.
Oh, okay.
O-level and A-level.
Look at the smile. You're a Gayaza girl.
Yay. And we never
A-level.
give up. Yes,
never give up.
Yes, I'm a pure Gayaza girl, and we never give up. Then university was at Makerere. So I did Bachelor's of Organization and Industrial Psychology.
Okay.
From Makerere University. Then I did my Master's of Science in Psychology at Linné University in Sweden.
Okay.
In Växjö.
In Sweden?
Yes.
Okay. But it's all been around psychology.
Yes.
Okay, so in school, to get you on this path, what were you passionate about when you were in school?
I think I've always been a people person, a person who wants to move people, to get people to places, it can be mistaken for leadership, though it is not the same way.
Oh, that's interesting.
It's not the same. That the leadership is you stand out.
You stand out and you guide
and you
forward.
guide. But for the people-centered, how I got into the psychology is I was interested in people, and I had people around me. I would gather people in one way or another. I would have groups of friends, and then I would try to be, either the focal person. I would get people from different walks of life, and people are like, but how can you be friends with that person, the other person? And I would see the different elements of the different people, and then I would identify with them.
Okay.
Yes.
So it's easy for you to relate with different people.
Yes.
I do remember a friend of mine once pointed out that whenever we go somewhere or to a party, I always look for the person who's quiet or the person who's kind of out of the group and make an effort to include them. This is way back in the day. I was like, oh, okay. So, sometimes you don't see it for yourself. Other people point it out. So you were very people-centered.
Yes, even from my family where I grew up. I grew up in a very large family and a homestead setting.
Okay.
So we were also very many children and very many people there. So also the dynamics of living with big numbers of people also teach you to understand, to see when the other person is annoyed, to know what the other person might be feeling, to know, how do I navigate this relationship. So it all tied in later when I went into psychology.
That makes a lot of sense, because sometimes you find with small families, they definitely want their children out in the world in a school setting or boarding setting, because you have to learn to live with others.
Yes.
They say you have to play with others.
Yes.
But if you grow up in a community, you automatically get some of those skills quite early in life. Okay, so that's kind of how we ended up in psychology. So in Gayaza.
Yes.
Did that mean you did sciences?
No, actually I did not do sciences.
So you did more of what they call the humanities.
I did the humanities and I did them very well. I loved them. And then when it came to getting the choices done, we had career days. We were given people to come to speak to us. So I just happened to listen to Dr. Ruth Senyonyi.
Okay.
She came for a career day that day, and she was a counselor at Bank of Uganda by then, and she had done counseling. But then she said, you can get here the same route by doing psychology as well.
Okay.
So I got interested in psychology. And when we were applying, it was actually my first course.
So you were sure about it?
Yes. I applied it first time and I got it on government.
All right.
So
did you discuss it with your parents, with your family, or you knew exactly what you wanted?
I think for some of the families that we come from, as long as you're excelling, if you come from parents who did not go to school that much and they're desiring for you to go to school and you keep bringing good reports, at the end of the day, they want you to know what are you going to do. You've been admitted to university. I actually got very good grades at A level, and then I got into the university. So the pleasure of me getting into the university, don't even inquire about the course that I was going to do. They inquired later.
Oh, well done. You know, the other people where they're like, now law or medicine, or, it's like your parents are like, if you do well, then we're going in this engineering and everything. But it sounds like you already had control over your own story.
Over my path, yes.
Quite early in life.
Yes, and you see, the other thing about is, of course, it doesn't take away the desire of traditional society to aspire for the standard career path. They don't understand why you can't be a doctor, why you can't be a lawyer, because there are those that have been deemed to be, very prestigious.
Prestigious.
Yes, yes. So, of course, there were questions here and there, not really questions of deterring me, but they were like, so why haven't you done law? Why haven't you done, A level? Why didn't you do?
I thought you had avoided all that. You had escaped it.
No. Of course, it has to come through. It's just that they were not firm. Like there was no conflict to the extent of where you say it's my way or the other way.
But again, you said you already had an idea of where you wanted to go. So I imagine your own confidence was like, okay, she knows what she's doing.
Yes.
So when you got to university, did it click for you?
I loved it.
This is it. This is what I wanted to do.
Crystal, I loved it.
Aww.
From the beginning to the end.
Hey.
And even my results showed. that whole thing of, when you're in class, if it's a discussion, if it is anything psychology, we would do different aspects. Imagine you're doing consumer psychology. So they're very applicable. You're looking at how can you convince people to buy your goods.
Yes.
If you're looking at the,
looking at our patterns as human beings and what we respond to.
Everything. I would just identify with it because they were so real. That the things that we were studying were relatable. So I loved psychology.
And the funniest thing, I think for a lot of people, now we're learning more, but for many people back in the day, they thought psychology, they immediately thought hospital and medical side of things. But you've just said in every aspect of life, psychology is powerful and important.
They can be psychology of war. They can be school psychology. There is psychology of everything. Of course, there are those core subjects that you have to do. For example, neurocognition or neuropsychology, that is it. You have to do personality, that is personal. Then you have to do social psychology, and then you can do community psychology to understand, because a person doesn't live in isolation. So you understand the person, their mind, you understand the person, their personality, you understand their behavioral psychology, you understand social, that person within groupings, that's social psychology, and then you can also understand the person in a community.
Wow.
There are those core ones that places you in a better state to understand a human being and their environment. Then there are the different ones. They relate the human being to the different. For example, there could be psychology of armed conflict.
Yes.
Psychology of war, could be psychology of people in refugee settings.
Yes.
So the different, there's sports psychology, there is that whole different range.
It sounds like you keep learning more and more and more.
Yes.
And you love that.
Very much. If you actually know that the passion that I have for psychology is something different, every other time that I am trying to think of doing school, like my husband keeps telling me, but you love school, why don't you go back and say, I'm going to go back? If there is a level that I can't reach, I will go and, because, and I will do psychology. I'm not deviating from any of it.
So you're so sure you know exactly what you want. Okay, so when you finish your first degree, time to come out into the real world. What happened for you?
So you come out with your, nice, maybe first class or something, and then you're looking around with your organizational psychology, and people don't understand what you studied.
That was my worry, at least back then.
Yes. And you go looking for jobs. Now the jobs are saying, but what you're applying for is close to human resource.
Oh.
You know?
What about now? Do you feel people have a better understanding now?
Yes.
Okay.
I think that we are going beyond you knowing just to know the people issues. You should know that person in an in-depth way.
Okay.
And even psychology is much more than the other fields that people have come to realize the importance of psychology because of the deteriorating states of mental health among people.
Exactly. So the jobs you were applying for were more like human resources, you said. Okay. Which was confusing to others.
Yes. No, because I wanted to first say, okay, I've done organization, or can I first try and do organization or go to organizations and see, we can look out for the people elements in these organizations. We can make a person thrive and then in turn perform better. I said, okay, so I applied and the jobs were not forthcoming. So luckily, I got into Standard Chartered by then, a long time ago.
Okay.
But it wasn't related to what I was doing. It was customer relations, So I was like, okay, let me be here for now. And then I kept applying. I got immediately, even before we got our transcript, before we graduated.
All right.
So I was at the job and then I said, okay, this is not what I want to do. Let me apply somewhere else.
How long were you there?
6 months.
And you're like, this is not for me.
6 months. I was like, no, this is not me. So I applied, and then I applied to a human resource consultancy. And then I got in. And for them, actually, the things that we're doing were part of a small section.
Okay.
Of the psychology that I had done. Because it had to do with recruitment, interviews, It had to do with organization development. And organization development, you have to do, people elements as well. You have to know the health of the organization, where you want the organization to be, and, It had elements of, there was training. And I loved training. So I was there for a while. And then I had just actually kind of settled in. I wasn't there for a long time though.
Okay.
And then I got a scholarship.
Okay.
To go study my master's. Yeah. So I had
that's when you were in Sweden.
Yes.
How long were you there?
1.5 years.
What was that experience like?
Lovely and homesick and okay. So I loved the education system. That actually I just realized one thing, that once you have been through the rigorous discipline of our Ugandan education system and then you're put in the other system, you can actually thrive if you are already disciplined.
Yes.
Because, for them, they let you think. There is critical thinking, express yourself. You learn. You learn without necessarily following a very set path.
Okay.
So it more or less self-taught. So I loved the way they taught. And I loved, of course, the culture of, you want to do a course unit, you read for it, you basically get all the information. They just guide you. Go get the
They trust you to do your part, because
do your part. So I liked the education, and then the environment was that, I think that was the coldest winter.
Oh no.
They were even touting it as the coldest in 100 years.
Oh no. That was just punishment.
So imagine you've been in your tropical Kampala and then you go and you're placed in
this ice box, which is
of Scandinavian countries. And then also the social life, there was a different because here in Uganda you can call your sister up, you can do whatever. So the isolation and the loneliness, and then even the people that you are studying with had their own lives. So you kind of had to occupy yourself.
Yeah.
And it could easily get into a little bit of depression if you're not very careful. And then of course by then we were Skyping. These other WhatsApp things were not here.
I know. Okay.
So we'd Skype and then send emails, and phone calls. The direct phone calls were expensive.
But I think you had to buy, was it a phone card?
Yes,
something?
a calling card.
A calling card, yes.
So you do the calling card and then you call home. And then, Skype, I would call Skype, and then, how the camera of Skype makes you seem like either flattened or something. So the first time I talked to my dad, I was like, but you look weird. Like, as in, are you okay? You look bloated.
Oh, wow. We've come a long
wonderful days.
Oh, my gosh. Now that you've reminded me, I'm like, we've come a long way. But it was a great experience.
Yes, very. I couldn't trade it for anything else. I loved that they informed my love for psychology. I loved that they take it so seriously that it actually informed my next course in life.
Okay.
I saw the way that people would respect a person who is actually trying to understand people. Like maybe hallmate who are in, housemates. Knew that you studied psychology, they would applaud you. Wow, you're doing psychology. It's a big thing.
It's a big thing.
The way they treat people that suffer with mental illness. And like generally the way they carry the vulnerable in society, If it's someone with a learning disability, the way they look around this person, how can we make their life better?
I love that. And they diagnose quite early people with learning, disabilities or issues, maybe just even disorders.
All of them. Because they've honed their skills at studying people, human behavior and people.
Yeah.
That even before you come into your own, like they've already identified, you're slow at uptake of information. Are you slow at, recalling things? Are you, so the child is, they don't look just at the physical growth. Even you as an adult, they look at adjustment issues. Are you well adjusted? Are you, And then so they guide into passion fields as well. So I love that they at least, of course, they're advanced in that field, and it kind of rubbed off me, and I carried it home.
Okay.
When I'm going home, I want to do something about mental health.
So is that how Safe Places Uganda happens?
Yes.
Okay.
Yes.
So you come back home.
And I am broke. And I am broke. And some of my classmates have jobs. And of course, when you're done with school, the next thing is you have to work. So I applied. There was this position that was advertised, by public service in one of the ministries for training officer.
Okay.
That is capacity building field. So I said, okay, I have my skills. I know people, I can do training. It was a tough recruitment. There were very many people, you had to go to Kololo. And guess what? The grace of God came through for me. I got a job. I was hardly here. I think I came back in in 2 months from my return.
And then you got this job.
I got this job.
Oh, wow.
So I go into it and I start work, public service. There 1 year, second year, third year.
And you're still thinking about this thing you want to do.
Yes. I would even talk about it because I met a colleague of mine, Ugandan, we studied with in Sweden. So we had exchanged those ideas. We even went to practicum in some of those institutions there, like social services related institutions.
Okay.
And we always thought that we should do this. So we would talk about it, but not do anything. Everyone is now hustling. We need food.
Yes, we need to survive.
We need to survive for now. So I went into the job. I did 5 years.
Okay.
5 years, and I was going into the 6th. But then I kept, I felt like something was missing. I felt underutilized a bit. I felt like, there's so much more I can do than what I'm doing at the moment. So I talked to one of my bosses. I told him, I'm getting restless. I'm getting, this thing, I don't think, it's going to work for me. He says, but it's unheard of. How can you live
public service? Yes.
And he told me, are you sure? Are you really, really sure? I said, maybe I could go back and study. At least, get more specialization in that field. And then I go out there. And said, but you have the qualifications. Why are you going to study? So as luck would have it, my family, I come from an entrepreneurial family, industrious and very hardworking people. So my family had a project coming up. Okay? So there was that whole thing of there's this project coming up with the family. Then there is me who was getting a little bit restless. I had 2 options. I would either go to school or I would go to work for the family.
For the family.
So I applied for school. I actually got in. I'd singled out I was going to do another branch of psychology. So I got in. I got into school. So just right before we started, before the payment and whatever, I asked for leave from work. Then misfortune, not misfortunes really, but an accident happened at my home. A gate fell on my son. Those sliding gates?
Oh. Goodness.
So it fell on him and I was home. It actually happened when I was home. So I got disorganized, and I was like, now this is what I am leaving my family for. Like, it was a aha moment for me. It was just lucky that he didn't pass away. I mean, he didn't die, but it was really unfortunate. My husband was at work. He was working in Entebbe by then. So I was thinking, okay, so what if I wasn't here?
Yeah, it was a very serious.
Yes, it was very serious. I said, what if I wasn't here? So he had broken bones and things like that. So it changed everything.
All your plans.
All. I said, now, you know what? These things of me leaving Uganda
To study more, no.
Let me use the skills that I have, and then do whatever it takes to bring about the change that I wanted. So I go to my parents. I tell them, you know what? I'm leaving the ministry. I'm going to start my thing with my friends, and then we go to other people, the experts in the industry.
Okay.
So we got together a team of 4 people.
All right.
And then we did a program, we did like what we would want, safe places to be. Even the naming, what is the rationale behind safe places? Like, we want a place where people with mental illness can feel safe.
Okay.
So what do we call that place? Safe places.
Safe places.
So I go to my parents, they say, if you're starting out the other side, but there's also this family project that is starting up and we need you.
Okay.
I said, but I can do both.
You can do both.
Yes, I said, I can do both. That's how I left public service. And I went back and tendered in my resignation. And then I joined the family and also started a new baby. That is Safe Places. So Safe Places, I had other 3 colleagues, the other side. And then family, I also had my sisters.
Okay.
My sister and brother that we're working with. It was a factory as well, a project. So that's how we started.
Okay.
And now we are here.
And now we're here. So when was this?
2016. So 2017, April is when we opened our doors officially.
Wow.
For Safe Places.
Okay. And how has the response been in the last 5 years? 5 years now.
When you have a dream, you believe the dream so much that sometimes the reality wants to check you a little. So here we are. We're opening a private mental health clinic. And people relate mental health to that bad word.
Yes, yes.
And they only know that the National Referral Hospital as the only place.
Place to go.
And then people are saying, but okay, who will come? Because even the people that we want to come do not want to identify.
Wow.
The ones who want to uptake the service.
So this stigma is very, very real.
More real than you can imagine. For the first 1.5 years, coming to close to 2 years, we opened, we staffed, and we're not getting clients.
Almost 2 years.
Almost 2 years.
Oh my goodness, that's a challenge. Hey.
And if it wasn't the vision, like the strength of the vision that we had and the belief that these services were needed, we would probably have closed a long time ago. We changed strategy. We said, now let us do advocacy. In addition to, we have treatment facilities and people do not know about the disease itself, the diseases, the illnesses. Let's do advocacy. So we tried to go out there, every opportunity we got. We started having mental health camps, we'd go to institutions. So we went to create awareness.
Okay, so you had to get yourselves out there so people know who you are and what you do.
And why they need.
Why they need your help.
Because that is also one of the biggest issues, that people do not understand mental illness. They do not understand mental health.
Okay.
Even to start with, before they go into illness. Most of it is associated with,
Yes, people are like, in the village, there's someone, my family, the other family, what?
They're doing things. They're doing things to me.
We like to go to that all the time.
So when you even tell the person that you look at the symptoms, they're like, you see, the voices, they're hearing voices of the people who died. They've come back to them, and you can tell them, okay, now this person feels they're persecuting them. Someone is out to get them. Like, okay, look at the facts. Look at the facts. Who is persecuting this person? Or it's it in their head that, they're being persecuted. So people do not understand.
I think we're just even now beginning to understand the distinction between mental health and mental illness.
Yes.
Okay. So at your facility right now, I know that you deal with psychiatric and psychological disorders, but for people who don't really have an idea, just to break it down better.
Okay, so what the services that we offer at Safe Places are mental, neurological, and addiction treatment services.
Okay.
So mental is anything to do with the person's, the way they think, feel, and behave.
All right.
Okay. So neurological, it usually has this basis in the development, the neurodevelopment of the person. So they're usually neurological development disorders. Something didn't, add up from the time of
birth. Huh?
Birth, yes. And then this person carries this disorder with them into adulthood.
Yes. Okay.
Then, substance and addictions. Because there are addictions which are not substance related, like maybe pornography, those other ones, which are not their behavior. But there are also those which are substance.
Addictions.
Yes. There are also those which are substance, like the cannabis, that's marijuana.
Yes.
The alcoholism, yes.
And other drugs.
And so we do outpatient. Outpatient is where people can come and consult, and then we can, if it's a mental disorder, then medication is given, or a form of treatment plan. Is it going to be medication and psychotherapy?
Okay.
So it can be done, outpatient, it can be done away from the center. You come consult, like how you go to a doctor in outpatient, a normal doctor.
Yes.
You get consult, be given a diagnosis, be given treatment and a treatment plan, and then you can go and come back.
Okay.
And then we do inpatient services as well, where we actually, if it's admission, so we have the programs for the substance use disorders, programs for other addictions, which are residential programs.
Okay.
And then we also have admissions for psychiatric disorders. So, for example, for psychiatric meaning mental disorders, which are not just substance.
Yes.
So, for example, Crystal, if you've been diagnosed with bipolar and you're in a severe state that you actually need to be managed in a health facility.
Like schizophrenia or things like that.
Yes, so we also do that.
Okay.
So among the outpatient, one of the biggest services is psychotherapy, which people call therapy. It can be in different forms. It can be art therapy, it can be talk therapy, it can be, it can even be just a consultation. It can be a career guidance, session.
Yeah.
So whatever you need is, as long as you need some sort of support.
Okay.
That we will do.
Oh, wow.
Then we're also going into organizations to do employee assistance programs because we know that they're there.
Okay.
That issues are what? The stress levels at these workplaces.
Yeah.
The loneliness that is going on, People like the burnout.
The burnout.
The burnout.
It's real.
So even people in organizations, so we are going to them and telling them, okay, we have packages. We can custom make one for you. What is it that you want? Can we do a needs assessment?
Okay.
Can we have a chat and understand? If you have questions about productivity, have you checked the people?
Yeah. And it's important to know if your people are okay as well.
Yes.
Are they coping? Are they struggling? Are they having issues maybe that are affecting their work? There's a lot to cover.
Have you given them an avenue where they can, reach out
and express and address some of the issues in the workplace?
Even just awareness talks. You can create awareness about the mental health of, individuals, because organizations are made of individuals. You can even talk about wellness, even if you don't want to talk about just general mental health. Wellness. Yeah. Because it all ties in. It's just not one thing. Yes.
There's a lot. And I can understand your passion for psychology because, again, you keep learning. There's so much to cover. Unfortunately, we're almost out of time.
Oh, my goodness.
Can you tell me more about Safe Places? How can we find it? Where is it? And how can we get in touch?
So Safe Places is currently in Chambogo, Plot 12, Lancaster Avenue. It's a general area of Face Technology, where they used to give driving permits from,
I know where you get your passports.
Exactly, where we get passports, And we are open 24/7. And you can also Google us and get the contact. But we also have our official line, which is 0770 700 944.
Okay. 0770 700 944. Okay.
And you can call as well. I also have a personal number, but if they're comfortable with that, then you can call that. And then that is in Chambogo for now.
Okay.
But we hope to get, because we've realized that people need more specialized amenities. So hopefully by the beginning of next year, we should have a bigger, in addition, a second safe place.
Okay.
Because our aim is to create safe places. So, Crystal, if you want to even just go for a down day, and can you go somewhere and have that down day? Because we call them mental health day. You are entitled to, and you should be able to take a mental health day, to cater for your mental health day. So we know that the services, the facilities that we have limited, so we want to create more. So by maybe, hopefully, first quarter of 2023, I will be here telling people, okay, now
we'll be waiting.
We're opening a second safe place.
Yay!
As long as we can cover the gap, but the statistics of the gap between the services and the users is also very wide.
Yeah.
Most people do not know where to get mental health services.
That's the thing.
Even the national provider, the National Mental Health Referral Hospital
is overwhelmed. Yes.
We have units at the different referral hospitals and the health center force, but people do not actually relate to them. They do not understand that they are there.
So there's still a lot of work and awareness to be done.
Janet,
thank you so much for joining me. Thank you so much for sharing, for the passion, for what you do. And we're waiting for that good news.
Please.
Coming soon,
very
right?
Soon. Coming soon. Just put coming soon. And you can also support. Come and we join hands.
All right.
And we do coming soon. Thank you so much for hosting me, Crystal.
My pleasure. Thank you for coming in.
Bye-bye.
Groove Cafe.